Good afternoon or good morning to folks out there on the West Coast, and hello. Welcome to today's event, Ask Me Anything, Stay Sharp, Microplanning for the Flu and COVID-19 Vaccines event, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and events specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleague, Sarah Price, Deputy Director of Public Health Integration. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been automatically muted and will be muted for the duration of this event. The duration of this event is approximately 30 minutes, including introductions and, of course, a live Q&A. Again, the duration of this live recorded event is approximately 30 minutes, including introductions and a live Q&A. Throughout today's session, of course, some of you have submitted questions in advance, and we want to thank you for doing that. But again, it is a live Q&A. So if you'd like to pose any comments, questions, or concerns, please use the Q&A box that's located in the lower right-hand side of your computer screen. Simply type your question into this box. Make sure you submit to all panelists. It should be like a little drop-down. You just want to make sure you submit to all panelists and hit the send button. Again, type your comments, questions, or concerns into this box at any time for the duration of this event. Make sure you select to all panelists and hit send. That's the only way we'll be able to get your questions throughout today's session. Finally, reminders that today's event is being recorded. Attendee lines have been muted and will be muted for the duration of this event. Questions should be filtered using the Q&A box located in the lower right-hand side of your computer screen. If we cannot answer your questions in the time allotted, we'll be made an attempt after the webinar is complete, and they will also be featured in our FAQ document after the event. At this time, I'd like to turn things over to Sarah, who will be introducing today's speakers and kicking things off. Sarah?
Excellent. Good afternoon, everybody. I hope my audio is okay today. We've been having some wonderful technical difficulties, but are working on it. Thank you so much. Again, I work at NAC, and it's such an honor to be able to present this Ask Me Anything session to you today. We have two great speakers and question answerers today. And we're going to start by giving each of them just a little bit of time to kind of do some scene setting for us in the world of microplanning for COVID-19 and also for flu. First, we'll hear from Claire Hannon. She's the Executive Director at the Association of Immunization Managers. She was our main question answerer last week, and which we thought went really, really well. And so she will speak kind of on the bigger picture of all things COVID-19 vaccine and microplanning from the public health and community health perspective. Then we have a wonderful special guest, Catherine Chichester. She's a nurse manager at Denver Health, and she is deep into microplanning right now for COVID-19 vaccine, as we'll be receiving some of the first doses for SQHC. So we'll let her speak for a minute or two just on how things are out there. Then we'll open it up for your questions. So start getting your questions ready. Again, the focus of this is microplanning for COVID-19 vaccine and flu. So that is kind of the scope of the questions that we're taking today. So first, let me turn it over to Claire. Claire, I think you're on mute.
Yeah.
Sorry about that. Thanks so much for the introduction, Sarah. You know, this is a really exciting time. It's, I guess, our last week of talking about what's going to happen with the vaccine, because next week there could actually be vaccinating going on. So I just wanted to level set a little bit and talk about where we are. You've probably seen that yesterday the FDA Advisory Committee recommended that the vaccine be authorized for emergency use for ages 16 and over. The FDA is expected to issue that authorization today or tomorrow. The ACIP will be meeting today. This is CDC's advisory committee, will be meeting today and on Sunday to provide additional guidance around the phased allocation and who is prioritized, and also to provide the clinical guidance around who should get the vaccine, if there are any contraindications, you know, if you should get it if you've already had COVID, all of these questions around the vaccine administration and the guidance there. So we're expecting that on Sunday, and hopefully it would be published by CDC on Monday. Meanwhile, the vaccine will ship out to the early sites. There's been over 600 sites submitted by states to CDC to receive the initial shipments of the Pfizer vaccine. They're expected to start arriving at these sites on Monday. And, we could see vaccination at hospitals. Most of these sites are hospitals that have ultra-cold storage capacity, and they could start vaccinating as early as next week. Again, it's a phased rollout. The healthcare workers and long-term care facilities are in the first phase, phase 1A, and we are seeing states approaching things differently with their initial allocation of the Pfizer vaccine. Some are looking to focus entirely on healthcare workers first and then move to long-term care facilities. Others are saying they want to do long-term care facilities first, although it does take a couple of weeks for that to kick in. And most are doing a combination of both long-term care facilities and healthcare workers with their initial Pfizer vaccine allocation. So the long-term care facility vaccine program is a partnership between the federal government and CVS and Walgreens. And it does take 2 weeks once you hit the go switch for CVS and Walgreens to actually go into the long-term care facilities and start vaccinating. So we were seeing several states, I know of at least a few, activating that program this week so that it could go live the week of December 21st, and many states saying that they would be activating it so that it could go live the week of December 28th. So I think you'll see healthcare workers getting vaccinated first, followed shortly thereafter by long-term care facilities. And then just to go over what's happening, most states are still enrolling providers for phase 2 and beyond. The supply and uptake will really dictate how quickly states move from phase 1A to phase 1B to phase 1C and beyond. So we need to keep our eyes on that. And I guess that's my update, just to kind of let you know where we are, and of course, happy to answer any questions.
Thank you, Claire. Thank you for that scene setting. We're going to move over to Kathy and then get to our questions. So again, Kathy is a nurse manager at Denver Health, and so is already microplanning for the COVID-19 vaccine. So we just wanted to hear a little bit from her about what that looks like, what kind of preparations is she making and some of the decision making. So Kathy, take it away. Thank you for joining us.
Thank you, Sarah, and thank you for inviting me to participate today. I've been on the participant side of many, many meetings like this, and it's kind of interesting to be on the panelist side for a change. So my name is Kathy Chichester. I'm a nurse manager for Denver Health. Denver Health is a large integrated safety net facility in Denver, Colorado. It does include a hospital as well as multiple FQHC sites. Since we are a hospital and we are the safety net hospital for Denver County, we are a phase 1 provider, and we'll be receiving vaccines probably early next week, which is a little frightening, but we'll get through that. Part of our planning has really been trying to do with, we have over 8,000 employees, and we will not be receiving 8,000 doses initially, so how do we decide, even among our employees, who receives the vaccines? We had a plan in place, and then the governor this week decided that their original guidance needed to be tweaked, and now in Colorado, we have to consider healthcare workers, long-term care facilities, and first responders in our 1A group. So that's added a whole new level of challenges to us. Fortunately, we do not have to manage the long-term care facilities. That does take a little bit off of our plate, but we do have to manage our hospital employees and our first responders. So fortunately, being in a large institution, we have a lot of resources. One of them has been something called a red cap survey that we have sent out to employees, asking them to sort of tier themselves. Who are they? Where do they work? Do they have any other comorbidities, so that we can identify our highest risk of our high-risk healthcare workers? And then once we tier out that, then as we get more vaccine, we can start looking at other groups as well. So we are deep in meetings and dry runs and practices, and I'm looking forward to answering questions.
Excellent. Thank you so much, Kathy. And yes, we cross our fingers for you. It must be kind of an unnerving time, for sure. So we do have a couple questions that we got ahead of time when people registered, but also we're getting some live as well. So I actually want to start first with Claire. A question has come up, and we really hit this point home hard last time as well, but there's still questions coming in about how to become a COVID-19 vaccine provider and kind of what's the best way to do that. So I would be remiss to not address that again on this call. So could you review how to do that?
Yes, and I think I said on the last call that we are working on this. We've been a little strapped this week, so we don't have it ready, but we are working on putting together a spreadsheet that would have the enrollment links for each state. So it is a state enrollment process. So you would need to go to your state website, your state public health agency website, look for the immunization program, look for how providers enroll in COVID-19. You can also look for the state's jurisdictional playbook plan for COVID-19 vaccines. And, there should be a chapter in there on provider enrollment, and that should provide information with you with where to go to enroll providers. We haven't actually gotten to the point where we've checked every website yet, but when we do that, and those links that are public facing that are on the website for provider enrollment, we'll have that spreadsheet for you, Sarah, as soon as we can get it to you. But yeah, you need to check with state public health agency, the immunization program, to see how to enroll as a provider.
Great, thank you, Claire. And another question on top of that is, one question that just came in is, how will health centers know where to obtain a COVID-19 vaccine? I'm sorry, how will health center staff know how to do that? So I think maybe a broader question may be, where does anyone get the information of where one might get a COVID-19 vaccine? And maybe this is in later stages as well, but any guidance on that, Claire?
Yeah, I mean, it is going to vary by state. I think you heard Kathy saying that they sent out a red cap survey to all of their employees. So that's really the way that it's happening now, is that hospital and healthcare systems, those who employ healthcare workers, are contacting them. A number of states are setting up sort of registration sites and pre-enrollment sites where you can go and sign up to get information. Because once we get out towards essential workers, to those over 65, yeah, you're going to need to know where to go. So I think that states will be doing this in different ways, many of them setting up a place for you to sign up for information, but they will also have websites set up. They will have a web page set up. They will have a hotline. So there will be information for you. Right now it's closed. It's by appointment only, and it's really going through the hospital and healthcare worker systems.
Great, excellent. We had one question about basically financing COVID-19 vaccine and the reimbursement piece. Someone had submitted that question earlier especially about Medicare Advantage. Don't worry, Claire and Kathy, I'm not going to ask you a question. I'm only making a comment. We actually have our State Affairs Department, as well as our finance folks at NAC, getting the answer to that question. So we will address that on next week's call and also answer that question directly to the person who asked it. So just want to let you know that's another kind of pocket of information that is, there's a lot of nuances to that. If any providers want to comment on the finance part, you're more than welcome.
We're getting a lot of questions on that too. So we've actually reached out to CMS to try to set up, getting some information. Obviously, the intent is for you to be able to submit to get reimbursed for the admin fee. And we're just trying to figure out all the ins and outs of how that will work. As the same as you are, Sarah.
Perfect. So we'll continue to work together as we have been. That's great. Kathy, we have a question that is coming for you, and this is on vaccine hesitancy. I know that's the buzzword right now because, you know, the worst part of having vaccines is not being able to give them. And so I'm wondering if you can talk a little bit about, you know, how you are working, not just with patients, but also with staff on their fears or any reluctance to taking the COVID-19 vaccine, and maybe how you're applying some of the practices around flu and applying that to COVID-19, if you don't mind speaking to that.
Not at all. And so one of the big differences for us from flu versus COVID-19 vaccine is flu is mandatory for healthcare workers in Colorado. The COVID vaccine is not. So we recognize that very early, that we need buy-in from our staff, and the more staff we can get to buy in, the better messaging we're going to send to our community as well. We actually started with a casual survey of our employees. Yes, I'll take the vaccine, leaning towards it, not sure, definitely won't, and try to get a feel even before we started our communications what people were thinking about it. And we saw the same thing seen in most of the national surveys, about 30% each way. So that led us to develop a lot of FAQ information, hearing the questions that were being asked, trying to answer them. I mean, everything from I'm pregnant, I'm breastfeeding, can I get the vaccine, which of course is still needs to be decided by ACIP, to will it alter my DNA? So a pretty broad range of questions. We also had one of our intensive care pulmonology specialists do an online WebEx and YouTube video going through vaccines and then going through the mRNA vaccine, because this is a new technology and it is very worrisome, the idea of asking your body to now suddenly start creating foreign particles. And we actually noticed that after we ran that, and we had so many participants from our agency, we actually crashed it for a little while, and we actually started seeing people coming back saying, I changed my mind, I want to redo my REDCap survey, and I want to now accept the vaccine. So we've tried to use our marketing department, our PR people, our specialists, anyone we can think of, to create as much information as possible to try and answer questions. And even knowing, even with that, there are questions we don't have answers to yet. And we've been very upfront when we haven't known the answer and not trying to snowball anybody.
Thank you. Yeah, I think always giving more information is better than not. And do you anticipate some of those FAQ documents and all will also be provided to your patients once it's rolled out more broadly?
Oh, yes, without a doubt. We have a lot of avenues for our patients to be in touch with us. We use Epic, so we have MyChart. We have websites. We have a COVID website, a subsite specifically on our website that we're also posting this information on so that it faces the community as well as our employees.
Excellent. Thank you, Kathy, for that. Another question that actually came in last week, but I got another iteration of it this week, and this is for Kathy, specifically about microplanning. There's a lot of kind of fear and uncertainty about exactly how to store this vaccine, what kind of needles are coming, you know, kind of those really, really micro details in the microplanning. Can you talk just a little bit about how you kind of set yourself up with that, how you're doing some of the staff training around that, just some really practical tips?
So like I say, I work for a very large agency, and so we have a lot of resources here. And one of them is we have a very good pharmacy team, and it's our pharmacy team who is responsible for the receipt of the vaccine, for the storage of the vaccine, and for at least our mass vaccination clinics for employees, the actual preparation of the vaccine. We have been, like everyone else, digging the internet, trying to find whatever resources we could on handling the vaccine. Pfizer did a webinar this morning on receiving the vaccine, shipment, preparation of the doses, storage of the doses, that we will use that information as well to help build we already started building our standard worksheets for that, and we're going to use the information from this morning's conference to give us some really good graphics on actually how you manage this. But it's been quite the team effort. We have our occupational health group who's actually helping us with the vaccination of the employees. And we're doing dry runs. We're actually doing one this afternoon of how we're going to get the vaccine from the dock to the pharmacy. And we will do another dry run of, we're calling it from the freezer to the arm, of how we get it from its storage in our ultra-low freezer, reconstituted, thawed, reconstituted, drawn up, and to the vaccinators to actually give. So we're hopeful these dry runs will help us find some of these kinks and issues before we actually start vaccinating.
Excellent.
I just wanted to add to that, Sarah, that the Pfizer webinar and materials that they're giving to the hospitals who are getting the early shipments, once the EUA is passed, they're going to make that available more widely. So we can give you that information and you can share it with your members. And when the EUA is passed, they'll be able to see it and go in there too.
Excellent. Thank you, Claire. And a follow-up quick question for you, Kathy. The video that you said that you showed your staff, people are asking for the link for that, about how the vaccine is created and what it does in your body. Do you have that off the top of your head?
No, I don't. I will have to reach out to our marketing people and see if that is something that is available for outside of Denver Health.
Sure.
And then I'll have to share that with you.
Okay. Thank you. Thank you. Another follow-up question to Claire is on finding a vaccine. There's something right now called Vaccine Finder, so you can kind of see where vaccines are in your neighborhood. Do you know, and if you don't know, that's okay, will COVID-19 vaccine be housed under that, or do you think it'll be a separate?
COVID vaccine will be housed in Vaccine Finder, but I'm not sure when that will go live. I think sort of once we get out of the limited supply and the closed pod delivery, every provider that is getting vaccine is required to put their inventory into Vaccine Finder, but I'm not sure when that's going to become open for people to see and check it. But it will, and the intent is for Vaccine Finder to be used for exactly that purpose.
Great. Another question for you, Claire, is asking about will health center, I'll just read the question, maybe it'll explain itself. Will health center locations be rolled up into a central federal database listing them as a COVID-19 vaccine provider after they enroll? Or will that be listed out, by jurisdiction, or how will that work?
When you enroll as a provider, your information is put into, is sent to CDC and put into the VTRAX ordering system, but it's not public facing. So you wouldn't be listed as a provider site necessarily because you enrolled. Once you get vaccine, once you have inventory, you would be putting that into Vaccine Finder, and then you would be listed as a site on the Vaccine Finder that has vaccine.
Great. Perfect. We have another vaccine hesitancy question. I think you kind of answered this, Kathy, but this is a little bit more specific. So this person, I assume, is writing from a rural area, or they have a health center in a rural area, and is really concerned about low flu vaccine rates. What is your opinion? Do you think we can anticipate the same issue for COVID-19 vaccine? And are there any strategies specifically geared towards patients that you're considering to address both the low flu vaccine uptake as well as potential COVID-19? So maybe Kathy, you can start, and Claire, if you have anything to add.
Yeah, so I'm trying to think through the answer on that. So our feeling is, and kind of what we've seen just in our casual surveys, is that people who are willing to take the flu vaccine are probably going to be much more likely to take the COVID vaccine. If you have somebody that just absolutely adamantly refuses flu, they're probably not going to take the COVID vaccine either. So, you never know. With all the push on why people should get vaccinated with flu vaccine this year to prevent the twin pandemic and the messaging that went out, it's hard to think that somebody would hear all that and get the same messaging for COVID and change their mind. One thing we are doing in Colorado is using trusted community partners. We started it with flu, and now we'll roll it over into COVID-19 vaccines to help us spread the message of this is important and you need to take the vaccine. This can be churches, community groups, respected leaders and community leaders trying to help build trust in a process that sometimes seems not very trustworthy.
Yeah, absolutely. Claire, anything to add? I have one last question for you all, for both of you.
No, you can go to the next question.
Perfect. Well, then this is a good closing one. This is our last question we can take, so we don't run out of time. As a strategy, and each of you can choose 3, what would you say are the top 3 priorities for health centers at this stage of the pandemic? Who wants to take that first? How about Claire?
I mean, I would say, be ready to enroll as a provider if you aren't already. Look at the information from Pfizer about the storage and handling of the vaccine, and definitely look at the education and communication materials and start educating as soon as possible, when the materials are out, about the value and the safety and the efficacy of the vaccine.
Excellent, Claire. Kathy?
And I would add, be ready for any vaccine. We know the Moderna is hot on the heels of the Pfizer vaccine. It does have different guidelines, so be ready to receive either vaccine. I know here in Colorado, where we do have a lot of rural areas, there's some conversations going around about prioritizing the Moderna, which is a little easier to store, over the Pfizer in rural areas. Be as familiar yourself as you can be with what the vaccines are and the handling, the storage, the quirks to each one, and if you're not already planning, start planning yesterday, because as we've been working on this for probably a couple of months, and we're still coming down to crunch time to actually be vaccinating.
Yeah. Thank you so much. I want to thank both Claire and Kathy for being on today, for answering the tough questions, but the really necessary questions. As we close, I just want to bring attention to just a few other opportunities that we know that there's a ton of different webinars out there, but wanted to let you know about the NAC ones. So coming up on December 16th, we have the 3rd part in a 3-part series on COVID-19 learning, talking about looking over the horizon, and that is mostly focused on, financing and in the recovery period for community health centers. So if you have your phone handy and want to scan that QR code to go ahead and register now, you can. It's also on our website. Next slide, please. We also will be back here again next Friday at noon. You never know who we'll have on. We'll definitely always be Claire, and then as we're getting questions that come in, based on expertise, we're also asking others like Kathy today to be on our call. But yes, we will continue on to January. There will be 2 Fridays we don't have, which are the holiday Fridays. But yeah, we hope that you register for this. There's also a QR code there to do so, and keep the questions coming, throughout the week, or when you register, or live on this webinar as well. Next slide, Liz. And again, just thank you to all of you. We know in the audience there's networks, there's health centers, there's some of our CDC partners, there's our NAC staff. We all know that, we're all working really hard together to try to do the best that we can for our communities and to hopefully get back to normal eventually. So we just want to always say thank you to the CHCs. Again, thank you to our speakers today, Claire Hannon, and Kathy Chichester as well. Thank you for being on and answering the questions. We will see you all next Friday. In the meantime, if there's any questions or concerns that I can triage for you, please feel free to email sprice@nac.org. I'm happy to take your questions throughout. And for that, I think we're set for the day. Thank you all.
Thank you, Kathy. Thank you. Good luck, Kathy.
Oh, thanks. We need it.
Yes, good luck.
Bye-bye.
Bye.